Hello, welcome to this special edition of a program here on UBC TV, where we are going to share with you a little bit about palliative care, but not the usual way. I happened to bump into a palliative care nurse down here in Lila City, and she's a very beautiful lady called Philomena. Philomena is going to take us into her experience. Philomena is going to, through her story, we are going to be able to appreciate why we need to know and get to know about the services of palliative care, because you never know as and when you might need these services. It doesn't mean that when you get to know about it that boom, death is going to strike, but it is information that we need to enrich ourselves with. Certain times there is a perception that possibly it's only meant for cancer patients or those with terminal illnesses, but let's get more about it from a palliative care nurse who is Philomena, and she'll be able to exhaust it for us to the depth through her own experience, her own career, having been at it for 14 good years. Much as she's retired, she's still into the business. What is palliative care? Palliative care is a multidisciplinary treatment aimed at improving the quality of life and overall well-being of people with chronic or life-altering illnesses. It might also involve support for loved ones or caregivers. That's why it's sometimes called supportive care.
My name is Okello Mary Philomena. I am 67 years old. I am a retired palliative care nurse, and I still continue practicing it. I first of all want to thank my friend called Winnie Ilem. She's the one who introduced me to palliative care. Though I had heard about palliative care when I was in Kenya, the hospice, which is in Nairobi, Kenya, I didn't take much interest. But when I came to Uganda, my friend called Mrs. Winnie Lem told me there is a course which is going to take place in palliative care, and she asked me if I was interested in it. I told her, definitely, I am interested. So I quickly consulted the people. That time it was being called Hospice Uganda Africa, but now the name has changed. So I quickly consulted them. That is how I joined palliative care. But when I was telling people that I'm going for a palliative care training, people were looking at me, who are you who wants to live with the dying? Are you going to be the angel of death? I was being discouraged in all forms and in all manners. But I determined in my heart, let me go there and see exactly what takes place there, what people are taught, and how we should come back to work. When I went to Hospice Africa, I found that is the place where I belong. That is the place where my heart is, and that is the place where I can work to help humanity. So I had that training at hospice. We were the second lot, and the training was intense. We traversed the whole of Uganda. We went in homes, we went where, and I learned a lot, which changed me, made me to be a better person, made me to know that a human being has the physical aspect, spiritual aspect, psychosocial aspect, and the cultural aspect. So as I look at a human being, I look at all those aspects. It has perfected me. It has made me who I am. And I will ever be very grateful to the person who introduced me to palliative care, because I can now help people, those who are in need, those who are desperate. It is deep in my heart. And when I came back, I remember the clinical director, commissioner, Dr. Jacinta Mandwa, when we were being commissioned to come out, he told me, Philomena, there are very many mango trees in Lira Hospital. I want you to go and start a palliative care unit under that mango tree if there is no place for you. But when I come to Lira Hospital, I want to find a palliative care unit functional. That word sank deep in my heart. And when I came, Lira Hospital, Regional Referral Hospital, is the first hospital in Uganda to have a functional palliative care unit. It's on record. When I came, the then doctor, who was the medical superintendent at that time, called Dr. Fred Nyankore, was very supportive. With the pharmacist called Thomas Ochua, they supported me, and we opened up a fully functional palliative care unit with all the drugs, with all what is needed, everything that is needed, they supplied. So whatever Dr. Mandwa told me, it was fully done. And I was just waiting for him. When is he coming to find me under the mango tree? He will no longer get me under the mango tree. He will get me in a beautiful house with rooms, with everything. So we started. And what encouraged me most again, the patients themselves. When they would come, you talk to them, you give them that wonder drug. Within 5 minutes, the pain is not there. They are very happy. I remember one time I had an accident. One of the children who was enrolled in the palliative care unit came to the unit and found I had an accident. People told him, she has an accident. The boy cried and knelt to God and told God, oh God, my Father, this lady here helps very many people. For me, I am sick. I know I am dying any time. God, for the sake of that lady, take my life and let that lady live so that she can continue helping others. And actually, that child died. So I know he sold his life for me. And that is one of the reasons why whenever I sit and remember the prayer of that boy, I just say, he prayed for me to be alive so that I continue helping people. And I know I am going to have long life so that I continue helping people. Palliative care is in my blood. I walk palliative care, I talk palliative care, I dance palliative care. Everything about me is palliative care. And wherever I go where they have not opened a palliative care place, I always speak about it. I let people know there is palliative care services. People should not die in pain. People should not suffer. So that is my passion for palliative care. I have very many success stories. If I am supposed to tell you, this year will not end. The year is not enough for us to finish the success stories because they are very many. The Bible says charity begins at home. I will start with my own home. My father had diabetes, had high blood pressure, and it was a chronic illness. My father enjoyed the palliative care, and I am happy to have prepared my own father to go to the Lord as a happy man, peaceful man. He died in dignity. When he had called all of his children, grandchildren, my mother, and talked to and told us what he expected us to be if he goes away. So that one I'm forever grateful. My own mother 2 years ago, I prepared her to die. I prepared my brothers, our relatives, that our mother is soon leaving. My mother called the girl who was looking after her to prepare for her breakfast. The girl came and found her smiling in bed. She had gone to be with the Lord. That is now from my own homestead. What of these others? They are just too many. We sit with them and we go through with them ongoing counseling and sit and let them know that they cannot be healed anymore. And when they go in denial, we accept it because that is a coping mechanism. But then we still continue and continue until such a time when they really accept, because I know it reaches a time when they will accept that for sure, this is it, I have to accept. The challenges I faced, you get your friends now in the palliative, they are enrolled. Within a short while, they die. Then you again start making again another load. So that is one of the pain I have, because I have also learned a lot from them, by the way. So you get your friends, they die. You go to some and you really find acidic poverty, whereby even coming to the hospital is a tug of war. Getting the basic things that they need is a tug of war. And more so coupled with now the corona issue. You find it's a challenge, but the best thing is we have been taught networking and referrals. So we network with different NGOs. We refer to different people. For example, we networked with the Community Development Department in Lira. They would come in and help us. With NGOs, some of them are no longer there, TASO, AIM, and they would come in. Incidentally, we even opened a unit, a room in the palliative care for legal issues. So it is one of the first hospitals in Uganda to have a legal clinic in a government hospital with the help of NGOs. So when they have legal issues, they would sit and they go through with the legal issues, and they are taught how to write their wills, how to do what, or they would write it for them. And then if there is a problem, we don't stick on it by ourselves. We refer. Those challenges are there. But once the challenge is there is always a way out. These patients normally come to the hospital. And then in the course of the palliative, we trained very many people. We trained the spiritual leaders. We trained the local leaders. By the way, we even trained the herbalists. We trained the community. So when they see such a patient, they would inform us, or they would take them to the hospital. And one day, the first person to be brought to the hospital was brought by a witch doctor whom we had trained. Carried the person, told that person that I cannot manage this case. The person had cancer, took to the palliative care unit. So I am grateful. Palliative care is for everybody. Palliative care is not only for cancer patients. It is only a part of that, a fraction. Palliative care is for people who have HIV/AIDS, because they all suffer what the cancer patients are having. Palliative care is for people with chronic illnesses. We are having people with sickle cell, they are coming to palliative care unit. People with burns, because of that pain which they are having, they are coming to palliative care unit. People with heart conditions, the kind of torture, psychological torture, the kind of pain which the cancer patients have, those people with heart diseases have. The people with kidney failures, the people with arthritis, name it, with all these chronic cases, they come to palliative care. And it looks at you as the whole human being. And by the way, you can even think it is the physical pain when it's the social pain which is affecting him. When it's the psychological torture that is affecting him, palliative care looks at that at a deeper way, more than the other aspects of life.
Palliative care includes prevention, early identification, comprehensive assessment, management of physical issues, pain and other distressing symptoms, psychological distress, spiritual distress, social needs.
I am extremely satisfied, very satisfied because of palliative care. Although there's some pain in my heart, because not all are receiving it. Not all know about it. Maybe those who are within the vicinity of Lira. Maybe those who have been referred to Lira. But then there are those others. I wish I could have wings and fly to every home and start identifying every home. Who is that person who has pain? And then they go and receive. Even these days, pain, they started hospital pain-free initiative. Whoever has pain is being now attended to. You don't go back to your home with pain. And we have everybody in Lira Hospital taught to identify those patients, to assess patients. And now if you go to Lira Hospital, every unit, every ward has liquid morphine. But it has not gone to that extent whereby I, as Philomena, feel. Because I also know there are those old people, as you grow old, there's a lot of pain all over. They still need that pain relief. They still need that counseling. They still need that encouragement. They have gone through a lot. Nobody sits to share with them. So I end by saying all of us need palliative care. All of us, I invite each and everybody, whether you are a child, whether you are a youth, whether you are old, whether you're a medic, whether you're a businessman, whether you're who, come and join us so that we make everybody get palliative care services. Let me tell you, my dear sister, these people, when you tell them, they are happy. Can I tell you that people, even when they are dying, they send messages. Their last words is, "Greet for me, Philomena." Tell her thank you very much for what she has done. So it is lack of knowledge. In the past, we used to go to the radio stations and tell people about palliative care services.
What are the benefits of palliative care? Symptom management support, improved quality of life, reduced risk of depression, longer survival, support in making decisions, support for family members and caregivers, improved caregiver satisfaction. Palliative care is available at any time, regardless of the stage of illness or life expectancy.
I only pray that the government should also come in so that we get some airtime and tell people about palliative care services, so that that kind of misunderstanding that once you go in for palliative care, you have died. I have patients whom we started palliative care unit in 2003. They are still alive up to today. They have managed to live, they have educated their children, they are happy, and they also are advocates. They also go and bring more. You are suffering here for nothing. Let's go to this place. So it is lack of knowledge, and we can't blame them. They don't have the knowledge. Once they get the knowledge, they will accept. And once somebody in their home state, when you have spent the whole night, the whole day, the person crying for you from morning till morning in pain, and then you come and get that wonder drug, within 5 minutes the pain is gone, and you also manage to sleep, who are you now not to come for palliative care? Who are you? You will definitely run for it, because you also that day you are going to sleep. You can also go do your work. You know, after 4 hours I'm coming to give the medicine. So you also get relieved. And after all, palliative care does not only look at the patient, it looks after the entire family. Because once a member of the family is sick, it also means the other members are sick. So all of them are brought on board. It is that knowledge that we have to pass it on to people. As I told you, palliative care is my heart. They still consult me. I still go. Even in the streets, when I find somebody in pain, I still manage to take them to the hospital. So that is priority number one, palliative care, because I want whoever is in need to get it. Number two, Okello District made me to be one of the commissioners in Okello District Service Commission. So I am working there as one of the members of Okello District Service Commission. I also teach the Lira University Department of Public Health. They invite me to teach students palliative care. So I also dig. I'm a farmer. So I am not redundant. I am very active, doing a lot of things for humanity, wanting to make the place a better place than I found it.
When to consider palliative care? If you have a serious or life-threatening illness, you can ask about palliative care at any time. There is a misconception that you have to wait till your illness is in a later stage or terminal to get palliative care. You are wrong. Palliative care is most effective when started early, closer to diagnosis. How do you get palliative care? The first step in receiving palliative care is to ask a doctor or a healthcare professional about it. The doctor who treats your illness should refer you to a palliative care provider. You can prepare for your palliative care consultation by making a list of your symptoms and how they impact your everyday activities. You'll also want to bring a list of medications you take and any other relevant medical history. It is a good idea to ask a friend or a family member to accompany you to your appointment. After the consultation, you'll work with your palliative care team to develop a plan. The plan will be based on your symptoms and any treatment you're currently undergoing, as well as how your illness is affecting your mental health, everyday activities, and family members. The plan will be carried out in coordination with any other treatments you're receiving. It should evolve over time as your needs change. If it becomes needed, your plan can also involve advanced care and end-of-life planning. Philomena has made it very clear to us. When we hear about palliative care, it is not only for cancer patients. You could have any form of chronic illness. It doesn't mean that you have to be terminally ill, like you said. You've said it has been even administered. You've heard her say it's been administered for people who even have got burns. The pain is what they try to help you to manage. It is good for somebody to die comfortable with little pain. The pain can be there, but it can be managed through palliative care. Philomena, thank you so much for your story, because it's been a story worth sharing to the people and to the public out there. And I think each and every one of us needs to be each other's keeper and neighbor, because from her story, that also came out very clearly. That's how she's been able to identify some of the cases and situations of where she's gone and being able to provide the support that is required. Join us next time for yet another interesting episode on palliative care.